Hello, this is Scott Burris from the Center for Public Health Law Research at Temple University, and I am here with Katrina Korfmacher from University of Rochester. We're going to say just a few words about the latest and final report in our series on health equity through housing, which provides our ultimate set of recommendations and a blueprint for going forward. This series, which has been funded by the Policies for Action program of the Robert Wood Johnson Foundation, was meant to be a complete look at what law is supposed to be doing to promote health equity in housing, what it actually is doing, and maybe what it could do differently to bring greater impact to this long-term crisis. Report 6 starts with a case study of some really interesting, innovative, community-driven work in Rochester that Katrina was actually quite involved with and knows very well. I'm going to ask her now to tell us a little bit about what happened.
Sure, thanks, Scott. So I started working on lead poisoning prevention in Rochester around 2000 and discovered when I first moved to Rochester that there was a coalition to prevent lead poisoning that had recently formed in response to a school principal who was really worried about students in his school not succeeding, not being able to learn, and realizing that there was a lot of literature that showed lead poisoning could contribute to problems like that. So he did a little digging and found out that 41% of the kids coming into his school had elevated blood lead levels. And that inspired him to ask where they were getting poisoned and what he could do about it. And he learned pretty quickly that most kids are exposed to lead in their homes and that existing policies reacted after kids got poisoned. They didn't look for the hazards in the homes and address them before kids got poisoned. So this coalition figured out pretty quickly that it wanted to change local policies so that homes were inspected before kids got poisoned. They looked around the country and found that there were some statewide models, but very few that were going to work for the Rochester environment, which is a very low-value housing market. Housing values on average were around $55,000 then. So they needed to find an affordable, effective way to address that problem, and there were very few models. So they looked for, based on research and experience elsewhere, to design the best possible the system they could, but also were mindful of the fact that this was kind of cutting edge work and that we were going to have to learn from experience, that there probably were going to be mistakes made. So that law baked in some ways of evaluating progress. So for example, the city is required to annually report how many inspections they do and what are the outcomes. They're required to coordinate with the county to find out where kids are still getting lead poisoned and at what rates. So we've learned it. Oh, and we also did some studies to find out how much it actually costs landlords and found that it cost less than they had expected. So we did as much as we could baked into that process to learn, to both inform that law based on previous experience and learn from it. And yet, despite everything we've learned about the success of this law, which has contributed to Rochester's lead rates coming down 2.5 times faster than anywhere else in upstate New York, very few cities have adopted this law or even models that are tailored to their own city. So one of the questions is why? If this was such a success, why is it that we haven't replicated it more?
Well, that's the question that we take on in this report. And it's really the question that I think emerges, or it's one of the sort of basic questions that emerges from our whole series of reports. We understand and found, confirmed in looking at the problem of housing, that it's very complicated. It's a big system problem, has to be understood in system terms. But we also found that a lot of the legal solutions that have been, or I should say solutions, that have been enacted and implemented over the last 50 years haven't actually delivered what they were supposed to deliver. So we have, on the one hand, complicated problems. We have lots of possible solutions, but what we haven't got is enough of what happened in Rochester, which is people getting together and figuring out in a particular place at a particular time how they can actually make those legal solutions that work in theory work in practice. And that's how we've come to the idea that's at the core of our report, our single recommendation, as it were, for much greater investment by those who lead and fund housing work in America, including governments, but also foundations and academia and even advocacy groups that are often the leaders in figuring out what's going on and taking action, to try and work together more systematically to do a kind of deliberate experimentalism. You know, we have in America this old revered idea that the states are the laboratories of democracy, and that all this diversity and variation in state and federal government allows us to try things all over the place, and that's true. The problem is it just kind of happens here and happens there, like it happened in Rochester, but there's not enough support for taking those ideas that work and putting them out everywhere they need to be, let alone support for incubating ideas and supporting more Rochesters to solve more of these problems through that kind of local creativity. So although we ultimately in our report have something like 40 or 50 specific recommendations that state and local governments and advocates can draw on and the federal government can draw on, I think our core message is these are solvable problems with political will, with sufficient investment, and with deliberate efforts to overcome the implementation and creativity problems that have plagued the housing story and progress in housing and health equity for really the last half century. So we hope you'll read the report, and we'd love to have your comments at any point from now well into the future as these reports spread through the ecosystem. Thanks very much, everybody.